Dr. Joe here. Now, vitamin B12 deficiency is exploding in the population. Why is that? Well, it's happening for a variety of reasons, but in today's video, I'm going to be sharing 6 of those reasons with you. Now, even if you are a meat eater, you're not immune from this very problem, this vitamin B12 deficiency scourge. Now, 2 of those reasons that I'm going to be sharing with you involve medications that are widely prescribed to you by your own doctor. So you really want to pay attention to this. A little teaser for you. One of the medications involves diabetes management. So you can understand why I said these medications are widely used in the population. So much so that the FDA equivalent in the UK issued a safety update regarding the side effects of this diabetes medication. So you really want to pay attention to this very video. How about we jump right in? We are going to be looking at the reasons why vitamin B12 deficiency is on the increase. And I have got 6 reasons to share with you. Let's kick off with reason number 1. And this has to do with excessive use of a group of medications we call proton pump inhibitors, otherwise known as PPIs, and other acid blockers. So I've got some examples of proton pump inhibitor medications here, like Prilosec, Prevacid, Nexium. You can ignore the Zantac. It is an acid blocker, but it is not a proton pump inhibitor. I put it here as reference to other acid blockers. In any case, Zantac at the moment, which is ranitidine, is banned for a variety of reasons. Anyway, the acid blockers and the proton pump inhibitors, what's their relevance to vitamin B12 deficiency? Well, here we go. It is because the proton pump inhibitors, they block acid secretion in the stomach. So here is your stomach. This is where you make some acid, and the acid is not designed, the acid that is secreted in the stomach is not designed to harm you. Rather, it's got some physiological functions. And one of those physiological functions of the stomach acid, which indeed is hydrochloric acid, is to dislodge the vitamin B12 in your food from the protein on which it is bound. So when you consume your vitamin B12 rich foods, the vitamin B12 is not bioavailable. It needs to be dislodged from the protein it is bound to. And one of the jobs of the stomach acid is to break the vitamin B12, separate it from the protein on which it is bound. So that's a very important function of the stomach acid. Now, like I've said here, if you therefore block acid production, which the proton pump inhibitor medications and other acid blockers do, you block the release of the vitamin B12 from its parent food. Make sense? If you block the acid production, you're also blocking the release of the vitamin B12 from its parent food, which means the vitamin B12 is not going to be bioavailable for you to absorb. So, not just that, by the way, a similar thing happens in a condition we call atrophic gastritis. And this refers to inflammation and thinning of the stomach lining. Anyone who suffers from this very condition will experience the same problems that PPIs do produce. So, like I said before, in your stomach, that's where the acid is produced. And if the cells that produce this acid, if they become inflamed and they thin out, then obviously you're not going to be making the acid. And that means you're going to experience the same problems that the PPIs do produce. So that is reason number 1. Let's look at reason number 2, why vitamin B12 deficiency is on the increase. And that has to do with the use of Metformin, another popular medication that we use for type 2 diabetes. And fairly decent research indicates that the use of Metformin may reduce vitamin B12 absorption. And as you know, a lot of the people who use Metformin, they tend to use it in the long term, which means they are at risk of becoming vitamin B12 deficient. It is a serious problem. So much so that we had a drug safety update from the UK government. And this is the document. It's a brief one. And it is titled Metformin and Reduced Vitamin B12 Levels, New Advice for Monitoring Patients at Risk. The advice, or rather the safety update, goes on to say decreased vitamin B12 levels or vitamin B12 deficiency is now considered to be a common side effect in patients on metformin treatment, especially in those receiving a higher dose or longer treatment duration, and in those with existing risk factors. We are therefore advising checking vitamin B12 serum levels in patients being treated with metformin who have symptoms suggestive of vitamin B12 deficiency. We also advise that periodic monitoring for patients with risk factors for vitamin B12 deficiency should be considered. This advice was issued by the Medicines and Healthcare Products Regulatory Agency, and it was published on the 20th of June 2022. So this is sort of relatively new advice regarding the use of metformin, which is, fairly common, and the risk of developing vitamin B12 deficiency. So that's a cautionary note for people using metformin in the long term, and that represents reason number 2. Let's move on to reason number 3 why vitamin B12 deficiency is on the rise, and that has to do with alcoholism. Okay, alcoholism. Now, we can do a 1 hour presentation on vitamin B12 deficiency, but I have tried to keep this presentation succinct. And for alcoholism, there are 4 reasons why alcohol may contribute to your vitamin B12 deficiency. So, reason number 1 has to do with damage to the stomach lining. That means no hydrochloric acid is produced. Alcohol use, especially alcohol abuse, does damage the stomach lining. That means your vitamin B12 in your food is not going to be bioavailable. So that's reason number 1. Reason number 2 is that people who abuse alcohol, they tend to have poor diet, which means that they're not going to be consuming foods that are rich in vitamin B12. And reason number 3 has to do with increased loss of vitamin B12 in the urine. What this means is that the little vitamin B12 that you are absorbing, you can't even keep hold of it. You lose it in the urine. And that is reason number 3. Let's move on to reason number 4 for how alcohol contributes to vitamin B12 deficiency. And that has to do with liver damage. Now, the biggest warehouse for storing vitamin B12 is your liver. If the warehouse is damaged, which is one of the things alcohol tends to do, liver damage, it means that your liver cannot store the vitamin B12 because the warehouse is seriously impaired. So, those are the 4 reasons why alcohol may be contributing to vitamin B12 deficiency. Let's move on to reason number 4 as to why we have an increase in vitamin B12 deficiency in the society, and that has to do with Crohn's disease. Crohn's disease. Now, Crohn's disease is largely a disease of the large bowel. So, this is a large bowel. You have what's called the ascending colon, transverse colon, and then the descending colon. This is the area where Crohn's really does affect the large bowel. However, the inflammation does spread to its neighbors. So the neighbor in question here is this little bit here, this bit here that the cursor is on. This is what we call the terminal ileum. Okay, the terminal ileum. So the inflammation does spread to the terminal ileum. And guess what happens in this little terminal ileum? This is where vitamin B12 is absorbed. Yes, the terminal ileum is where it's absorbed. So if the inflammation from Crohn's disease spreads in this direction, that means you are not going to be able to absorb your vitamin B12, and that will lead to vitamin B12 deficiency. That is essentially what's happening in Crohn's disease. That's reason number 4. Let's move on to reason number 5 why vitamin B12 deficiency is on the increase, and that has to do with increase in bariatric surgery. So, on this side here, this is a procedure we call gastric sleeve. Okay, gastric sleeve. And what happens is they slice the stomach along this line here. So you lose 3/4 of the stomach and you're left with this portion here. Now, on this area that is sliced off, you have cells here we call parietal cells.
these cells, they make what we call intrinsic factor. And you need intrinsic factor to carry the vitamin B12 from the stomach to the small intestine, the terminal ileum, where it is absorbed. So if you slice all of this off, that means you lose a lot of the parietal cells. Plus the fact that this area that is being sliced off also produces acid too. So you can now see two reasons why a gastric sleeve procedure can lead to vitamin B12 deficiency. Here's another procedure. This one is called Row-NY procedure. So what happens is a huge chunk of the stomach is sliced off, and you're left with this little golf ball size of a stomach. This is all you're left with, this little golf ball size pouch here. And not just that, you also have a diversion that takes place to avoid all of this area. And what this means is that you're also losing the parietal cells because this is sliced off, and also the acid production. And of course, that will then lead to vitamin B12 deficiency. So these weight loss procedures tend to remove a huge chunk of the stomach where intrinsic factor is produced, as well as the hydrochloric acid. And then, of course, if you lose the intrinsic factor, which is the taxi that takes the vitamin B12 from the stomach to the terminal ileum, if the taxi is not available, then you're not going to absorb the vitamin B12. So there you go. That's reason number 5. Let's move on to reason number 6 as to why vitamin B12 deficiency is on the increase. And that has to do with this condition here called autoimmune gastritis. And in autoimmune gastritis, the parietal cells that I talked about earlier on of the stomach are destroyed. And that means you're not going to be making intrinsic factor, which I mentioned earlier on too. And you need the intrinsic factor to facilitate absorption of vitamin B12. If there is no intrinsic factor, then vitamin B12 is not going to be absorbed. And that results in what we call pernicious anemia. Okay. And I use this image here. This is the gastric sleeve procedure, but it kind of represents what's happening in autoimmune gastritis, because if all of this area is inflamed, then obviously the intrinsic factor is not going to be made, and also no hydrochloric acid is going to be made in the stomach. That is another reason why we have an increase in vitamin B12 deficiency, because of the increase in autoimmune diseases in general, and also autoimmune gastritis.
Okay, so those are the 6 reasons I wanted to share with you in today's video. Now, as an offshoot of this very video, I want you to let me know, how long ago was your vitamin B12 test done? The blood test for vitamin B12. How long ago was it, or how recent was it? You don't have to be precise. How many weeks ago, how many months ago, how many years ago? Do let me know in the comment section. So I'm hoping that you got some value from this very video. If you did, please give the video a thumbs up. Please like the video, and also please share this video with your friends, with your family, with your colleagues. Any questions, any comments, leave them down below. That's it for this video. Until next time, well, this is Dr. Joe signing out.